Demand for several diabetes drugs, including Ozempic and Victoza, are on the rise, but the reason for that demand is being called into question because some of them are being used for weight loss. So now many drug makers are struggling to meet demand, and doctors say that off-label use of these diabetes medications for weight loss is creating a big problem for patients with diabetes who can't actually get the drugs they need.
Well, joining us now to talk about it is our 9 health expert, Dr. Kohli. So first, let's talk about the health issues here. I would imagine taking something meant for diabetes, if you don't have diabetes, strictly for weight loss, may not be a healthy choice.
You know, it's interesting because the drug was designed as a diabetic drug, but as they were studying it in diabetics, they realized that it was resulting in weight loss. So it's actually been studied in patients without diabetes, just obesity for weight loss. It's been FDA approved as well. But there are some key differences in the drug when it's used for diabetes and when it's used for weight loss.
So I know this got a lot of buzz when they saw some things with weight loss. Everybody wants that magic pill. But how are they?
Injection, in fact.
Right, an injection, I should say.
Yeah.
So how do they decide, and how is it used differently for somebody with diabetes?
So the dose is higher.
Oh, okay.
And what we see, interestingly, in the clinical trials is that the diabetics actually lose less weight than people without diabetes who are using that higher dose for obesity. So it's really got two indications. And it's interesting because the same drug is marketed under different names. For example, Ozempic and Wegovy.
I've heard that name.
When it's exactly the same drug, just different doses used for different indications. Now, the trouble here that we're getting into, and as doctors, this is a tough situation because we're using off-label Ozempic, which is a diabetes drug, for weight loss, where it should actually be the Wegovy. So the diabetics are not able to get the Ozempic that they need.
So these shortages, I mean, these are significant. Obviously, for diabetics, you're talking about, it could be the difference between life and death even.
It could be, and it's really an ethical dilemma because, of course, diabetes and obesity are both terrible diseases,
right,
and they both need treatment. But you cannot rob Peter to pay Paul here. So you cannot use the diabetes drug to treat obesity. And really what we need to do is put more pressure on the manufacturers, because at this point, we need to manufacture more of the diabetes drug and more of the obesity drug so that both groups can get access to those medications.
And so when people hear about this, there are those that say, woo, I've got a class reunion coming up. Can I do this? I mean, that's not how this is used.
Definitely not. And that's the message we want to send here because, whether it's Elon Musk or Kim Kardashian or all of the celebrities that are using it for quick and easy weight loss, yes, it's effective. But what we're seeing is that when you stop taking it, 2/3 of people gain that weight back. So that's message number one. Message number two, there are risks to these medications.
I would think.
So
I was going to ask you, the big questions, I mean, drugs for weight loss tends to be a pretty risky proposition. Has always proven to be one anyway, hasn't it?
It has, but I would say that this class of medications has sort of turned that on its head because it's effective. It's been shown to improve cardiovascular outcomes, so it actually reduces heart attacks and strokes by making you healthier, but only in the right person. If you're already thin, you're not obese, and you just want to shed a little extra weight, you can increase your risk for conditions like thyroid cancer, which it has a warning for.
Are we talking about these being prescribed, though, by doctors? Is that part of the problem, is that doctors are in the middle of this?
It is, and I think the doctors have really sort of woken up and taken obesity seriously as a medical condition, which I'm so grateful for.
Yeah.
But I think the problem here is that because there's such a demand also from the patient, and this happens to me almost every day. I have a patient sitting in front of me. My mom even asked me the other day, can I please have this drug to lose a little bit of weight? And so you really have to weigh the risks and benefits because not only are you thinking about that patient's candidacy, but you're also thinking about taking it away from somebody, a diabetic patient who might need that diabetic drug.
It's a complex issue.
Yeah, it
There's
is.
a lot there. Dr. Kohli, always good to
Telling
see
mom
you.
no isn't fun.
I told her no.
I know you did.
I told her to get on the treadmill.
Yeah, you did.
Tough. Thanks again.